the pumpkin patch like Maggie and feel pain in your joints, it may be related to osteoarthritis. Joining us now to discuss this and how physical therapy can help is physical therapist Dr. Sherry Betts. Good morning. Thank you so much for joining us.
Good morning. Thanks for having me.
So let's start off with understanding what osteoarthritis is and what are some of the common signs and symptoms to look out for.
It is a condition that is characterized by degradation or wear and tear of the cartilage or that cushion between the bones. It commonly occurs at the hip, the hands, the feet, and the knee. We know that about 32.5 million Americans suffer from osteoarthritis. And if you're experiencing pain in your joint, stiffness in your joint, or crepitus, that creaking, cracking sound in your joint, then physical therapy might be able to help you.
Ooh, that's a good idea. So tell us, what are the common myths regarding what people with osteoarthritis can and can't do?
So often people avoid the very thing that they need to be doing, more movement. And a physical therapist will often guide you through low-impact activities such as water-based therapy to give support to that joint, progressing to land-based therapy such as cycling, weight-bearing exercise such as brisk walking, dancing, aerobic activities that you enjoy doing, sports activities, and then adding in some strength training, which people also often avoid. So often I see people with decreased leg strength that could really benefit from the support and shock absorption that occurs around that joint with strength training.
Oh, wow. So my mom has osteoarthritis, and I would now love to get her into a physical therapist. So what do I tell her on what PTs do to treat and help people manage their symptoms?
She can expect that a physical therapist will provide a head-to-toe comprehensive assessment. They'll look at her gait, her flexibility, her mobility, her function, and see if there's anything that they can do to reduce those forces around that arthritic joint. They might even see how she's weight bearing on her feet, advise her with proper shoe selection, and then they can prescribe a tailored exercise program to get her back to doing the things that she loves doing. I have a patient that I saw that had severe osteoarthritis of the knee, and she wanted to go on vacation with her family and climb those 135 Spanish steps in Rome. And she was able to do that after a bout of physical therapy for several weeks.
That is incredible. Kudos to her. So where can we go to get some more information?
You can go to choosept.com, where you can see a recently published report by the American Physical Therapy Association that compared steroid injections to physical therapy and found that physical therapy was lower in cost at about $14,000 per episode and more effective for especially functional improvements than the steroid injections.
Wow, Dr. Betts, you made me a believer. Thank you so much for joining us today.